Well, hello and welcome to all of our viewers here today. I'm Fiona Langsharp, IBCLC Director of Communications and MC here at Gold Learning. I'm so excited to be here today. We're coming to the end of the year, but yet we're planning into the future. And we've got an amazing event coming up at the beginning of the year on January 18th. And you can see that one of our wonderful presenters is here today. Dr. Alison Hazelbaker is going to be with us talking on our Gold Learning Day 2022 about pain assessment and management during lactation. You can get all the details on our website right now at goldlearning.com. And of course, if you've got any questions, you can always pop them in the comments below. Be happy to answer them for you later on. So welcome back, Alison. It's absolutely delightful to have you here today. How have you been?
Well, I, just like everybody else, have struggled with relatively recent events, but have tried to keep myself, or actually was forced to keep myself busy going back to school. As in 2019, the law changed that redefined the practice of craniosacral therapy as massage therapy. So I had to go back and get a massage therapy certificate and obtain an LMT license. So much to my chagrin, but it led me to the subject matter at hand, because I learned a lot about myofascial trigger points and realized that that information had some bearing on what it is that we see with deep breast pain. And interestingly, kind of broaden my understanding of what to look for on a structural basis. And of course, I've been working structurally for a long time with lactation. So it was really kind of a critical piece to put into place. And that's why I want to share that with your audience in this presentation that we're going to be doing on subluxations and trigger points.
Wow, I'm blown away right now, just because I actually didn't know that about you. So you had to go back to school and get the RMT. How was that for you? I mean, I know you said you discovered maybe some things, but that's a lot of time. It's a lot of time to take out of your life on a day-to-day busy. I know you're busy with clients still, but you got through it okay.
Well, as one does. And when you have a PhD, you can't exactly get anything less than an A. So, but on the other hand, the upside was that I had already had a lot of that material. So the A was relatively easy to come by, but it did eat up a lot of the time that I would have rather been spending on my legacy project. And that's my online portal for education. And where we've gotten the phase 1 going for the Hazelbaker Lactation Institute, which your learners may be interested in. I invite people to check it out so that you can see, what's going on that score. We've got lots of different presenters and a lot of my material up on that online forum so that people can come and share. And in phase 2, we're going to be doing the craniosacral training for lactation consultants. So I'm really excited about that as we continue to expand and connect people with the kind of unique material that I provide.
Oh, wow. Well, I think that's always what's been so attractive about you, honestly, Alison. You've been my go-to person to learn about sacrocranial things and myofascial things. I always come away feeling better versed, but also really hungry for more. So the fact that you're putting together this platform, and I know you've got lots of education there already, this is going to be a real gift, honestly, to the community, to get their continuing education as they want to grow in this particular area. Alison, can you just roll me back a little bit and tell me how and why you got into this particular area of lactation and, as part of your journey?
Well, gosh, my journey's been a long one. So I've been working with breastfeeding mothers and babies for 40 years now.
Hmm.
And, my mentor was one of the master originators of this field, and she was a speech language pathologist. And, I learned some formidable skills from her. But in the 1990s, when we started to see the changes with birth and back to sleep campaign, et cetera, the babies,
Hmm.
we saw normal babies having, really significant problems. And that problem that has just grown. So
Mm,
back in the 1990s, I decided that body work was an appropriate skill base
right.
to include. And as we continue to explore, structure and function, and really get a handle on how structure impacts function, and
Hmm.
certainly problems with structure can create pain, then it's a logical next step for us to explore the unexplainable by
Hmm.
experimenting around with working with structure.
Mm,
And so I think that that's kind of what's brought me to, I've worked with the babies for so long and done tons, thousands and thousands of craniosacral treatment on babies. But I think now the opportunity is to look at their mothers or birth parents and see, okay, how can we use these same skills in order to make breastfeeding more comfortable for moms who are experiencing the unexplainable deep breast pain, which I think is actually very explainable and physiologic. So here we are.
here we are. And yeah, I think I've seen a lot of conversations around breast pain, specifically recently. And I mean, obviously with the demand, that's why we, put this package together, and we're delighted to include you in it. And it seems like, for some practitioners, for other folks that we collaborate with, it's dismissed. Often I see, if a parent comes to me and they've already, been told that there's nothing wrong with them, that everything looks fine, they don't have any other type of condition or disease, and the breast pain is now just considered to be normal. And I find that particularly concerning. Alison, is that something that you have seen as well?
Well, I certainly am seeing more of it.
Mm,
And with women going, I'm just, it just hurts so badly, and it's not nipple pain, it's that
no.
deeper breast pain, and it just hurts so badly, and nothing makes it go away, and so they stop,
Yes.
which is it's a real shame. I mean, it's a real loss, as we well know, being breastfeeding supporters. But I think back to a case that I had back in the early 2000s, where the mother had deep breast pain no matter what we did. And we resolved the infant sucking issues. We, healed up her nipple damage. I mean, we did absolutely everything. And still 9, 10 months into it, she was having deep breast pain. And I think back
Mm,
to that situation and wished that I
hmm.
knew about trigger points at that point, so that I could have gone in and done some correction, or sent her to somebody who knew how to
Right.
work with that deeper fascia. So
Yeah, well, I think this is going to be great, because I think that even if, it's if it's out of someone's scope, they can at least ask the question of the next practitioner, or find out if there's someone that's practicing this in their area, which is just going to be so important. Because if we don't ask the questions, then the demand is never there in order to, to make the changes that we need in our communities. Well, I'm really looking forward to it. There's never a time that I've been in one of your lessons or presentations that I haven't learned immensely. So thank you so much for joining us once again here at Gold. It will be wonderful having you on January 18th.
well, I certainly appreciate it, and despite the hiatus, I'm thrilled and pleased that I have something new to offer that could potentially be of significant clinical help to people.
Yes, absolutely. Absolutely. Well, thank you so much. And just a quick reminder for all of those listening in, you can come and join Alison Hazelbaker and our other speakers on January 18th. If you go to the website right now at goldlearning.com, you'll be able to register for the event. Check your emails for the latest updates and join us, of course, on our social media sites. Well, thank you so much once again to Alison Hazelbaker for joining us here today. Have a wonderful rest of your day, everyone. Bye-bye for now.